Welcome back to Fox 8 News in the Morning. It's been a grim week as coronavirus cases spike across the country, sparking mask mandates in many cities and states. Infectious disease doctor Alan Tagey joins us now live this morning. Doctor, thanks for being with us.
You're welcome. Good morning.
Let's talk first about what you're seeing as far as cases at the Cleveland Clinic.
We were very fortunate about a week ago to believe we were seeing cases slowly decline, but unfortunately we're starting to see an uptick in this last week where the cases are slowly building again. And these cases, oftentimes that come to the hospital, have been older people, but currently we're starting to see more younger cases showing up.
Let's talk about the study that was posted in the journal Cell. It's kind of confirming this new version of coronavirus. They're saying that it spreads faster but doesn't make people sicker. So if that's the reason, if it's true, is that the reason for more hospitalizations rather than deaths right now?
I would have to say that if it is making people less ill, it is unlikely that they're going to come into the hospital, because most of these people who present for evaluation, when they have the symptoms of coronavirus, if they are doing reasonably well, they are typically asked to remain at home unless certain things begin to happen, such as becoming more short of breath and so forth. So if it's making them less ill, they're less likely to be hospitalized. So unfortunately, the more hospitalizations would still suggest that we're having people become significantly ill.
Okay. Also in this study, it talks about convalescent plasma. Obviously, the COVID research is continuing, trying to find a vaccine. It seems like, from what I read, it's kind of an old therapy that's become new. What are your thoughts on that?
I suppose we could classify this as old therapy, and it's something that came about over the course of the last couple months, where you harvest plasma from patients who have already been infected with the coronavirus, and then you give this to patients who are currently ill to try to help them improve and to become well again. It has shown some promise in several of the studies. We know that it's not 100% effective for everyone, but it's still another modality that we are very pleased to have to try to help patients overcome this illness.
So, sure, moving forward at least a little bit. You had mentioned the young people. We've talked to a couple doctors already in the last couple weeks. We've seen them on social media, at parties, in bars. It's the young people now that are being infected, as you just mentioned as well. So the governor talked about that, but it's not just them now. Apparently, it's everyone who's being careless. So talk a little bit about that. Maybe you can speak to the young people who are watching right now, but what do they need to keep in mind, especially this weekend for the holiday?
Here we have a beautiful holiday weekend, and of course, everyone wants to get together with their friends and family. And that's understandable, but we must still be careful because, yes, indeed, as you just mentioned, we are having a lot more cases show up in the young age groups, 20 to 35, 35 to 55, and this has now become the majority of the new cases we're seeing. So as all of you who are wanting to get together over this weekend, please do your social distancing. Use the hand sanitizers, and we really ask you to use the mask. These things are not all perfect, but they certainly decrease the chances of you acquiring the illness and of you carrying it and giving it to someone else.
So, Dr. Tagey, you agree with Governor DeWine with this mask mandate in parts of Ohio and the country?
I firmly believe that this is a helpful modality that we should all be trying to practice. It's not perfect, as I said, but it certainly decreases the risk, and it is imperative that everyone try to do their part to keep this from spreading more and faster.
As we wrap this up, a lot of parents are waiting for Governor DeWine to talk about schools so they could start making plans. What are your thoughts on Governor DeWine's guidelines?
The guidelines will be useful. There's a lot left open to each of the school districts themselves, but I think it is very important that we find a way to help these children and young adults get back to school, not just for learning, but because of the social aspects of being together in school. And there's a further benefit for a lot of children who rely on the school system for some of their nutrition and meals. So we must find ways, and I agree with trying to get the schools open. We just have to do a lot of work and be extremely vigilant as parents, but also as teachers and as students themselves to try to prevent the spread of this illness.
Sure. All right, Dr. Alan Tagey from the Cleveland Clinic, thanks for joining us this morning. We really appreciate it.
You're welcome. Have a good day and a safe weekend.
Same to you.